From the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Beres here on a Wednesday. We've got a health-related program today where, once again, we'll open up the phone lines and your chance to call in, join in the conversation, get some free medical advice as we talk about your eye health, eyes, vision care. You know, we do this pretty much every month. We'll have someone come on, and actually we have the one doctor come on who will talk and answer your questions, because it's not going to be me. I have problems with my eyes. My problem is I don't know exactly how to correct it except wear the glasses, and so far it's working. But there's a lot of other issues we're going to talk about this morning. Cataracts, if you have an issue with that, glaucoma, macular degeneration. These things I know many of our viewers deal with, looking for ways to treat them, wondering if they need to go see an eye doctor about it. Those are just three of the topics I know we've had calls on in the past. And your chance to call now and join in the conversation if you would like with eye doctor Nichole Rudowski. Good morning.
Good to be here.
Nice to have you on. It's good to see you.
Thank you.
Of course, she has her practice there in Rutherford County, right?
Yes.
You were just off of I-24.
We are off exit 70.
Exit 70, Smyrna, right?
Yes.
And you have an open house that's going to be there tomorrow, correct?
We
Is
do.
it tomorrow? Yeah.
Yeah, absolutely. It's going to be from 3 to 7 tomorrow, and we're going to have several different vendors. They're going to bring all their frames. That way you have a lot more to choose from. If you don't have insurance, we're going to get big discounts off of them. Lens giveaways, frame giveaways, lots of different door prizes and goodie bags. So
It's a neat
definitely
thing.
come and visit, yeah.
I'll tell you what, if you haven't shopped, and a lot of people, you know, have glasses for years, and then at some point they decide, finally, I better upgrade my lenses. One, two, I want some updated frames. Wow, they're not cheap.
They're
you think,
not.
I mean, and to get a good one, or one that's got a style, and there's all kinds of designer brands out there now,
Absolutely.
right? And some of these designers, you know, you're paying for the name half the time, but boy, they're not necessarily cheap. You can find an affordable pair if you need to, but if you're looking for a sense of style, or maybe something that's going to last a little bit longer, it's going to
Absolutely.
cost you. Same thing with what's increased more in value, the frames these days or the lenses?
The lenses,
Okay,
absolutely.
the lenses, and they are better than ever.
Oh, absolutely.
Digital now, right?
Yes.
The big thing about digital, as you've taught me, is that it's more across it increases your peripheral vision, does it
Yes.
not? Whereas in the old days, the other lenses may be a little more limited.
Absolutely, and he's talking more about the no-line multifocals
right.
with those. With the progressives, they're wonderful with the digital. They even have digital single vision, and it just gives you much crisper, clearer vision. But absolutely, with the progressives, when they're digital, it widens your channel a lot. A lot of people complain with the progressives, they have limited peripheral vision with them, and the newer digital ones are amazing. You almost don't even notice the peripheral vision distortion, which is
nice.
great. Absolutely.
Which is nice when you're driving or anything else, or playing sports, whatever. It gives you more, I don't know, just range of vision.
Absolutely.
Well, the number is 737-7587. We'll open up the phone lines, but I wanted to hit you with a couple of questions just about what you've seen of late. I know last time you came on, we were talking to some degree about this time of year and some of the conditions you'll see, be it people coming in with, you know, pink eye or dealing with the allergies. Is that tapering off a bit? Is it picking up? What are we seeing right now?
I would definitely say that the allergies are picking up.
What is it now? Ragweed, or what the heck's out there?
There's so much
Maybe
with
they'll
the
tell
season
us.
changes. I've been prescribing a lot of steroids to get the bumps down. You get a lot of bumps underneath your eyelids when you end up getting the allergies, and if you can get to it before it gets really bad, a lot of times antihistamines do a great job. But if you wait till you're extremely flared up, I went through it for a couple weeks even pre-treating myself with it, or my eyes were just red and itchy all the time, and it just sometimes steroids are the only way to go with it.
Now the steroids, are these drops that you're
Yes.
putting in? So are you also taking anything oral as well with that, or is it just eye drops to treat
Usually
that?
with the allergies, I will tell people if they're going to take any kind of eye drops, it's going to be the steroids or even the antihistamines if we can get to it. Oral antihistamines do a good job too helping out. So sometimes even if it's really bad, Benadryl at night, just taking your dailies, Zyrtec or Singulair or something like that really helps out as well.
Okay, and I'm wondering what kind of conditions cause blurriness of your vision? Again, and I know there's going to be some very clear-cut ones where there's injuries and like.
Sure.
Now, having severe allergies, you know, when you get swelling or you get the bumps underneath your eyes, which is just a swelling from this, can that affect the quality of your vision?
Absolutely. Any inflammation on your eyes can cause an extreme blur. A lot of times you're not producing enough tears during that time as well, so your eyes are very dry. The cornea, that front surface of your eye, can be really affected by it as well. So there's so many different things, whether it's allergies, obviously things like cataracts and macular degeneration can cause blurred vision. Even different medications can cause blurred vision too. So a lot of people, when they come in with blurred vision, the first thing I do is look at their medications, see what they're going through, and we kind of try to weed it out from there, what's causing that blurred vision.
Do they most of the time pick up on it right? I would notice it immediately, but I sometimes wonder if it happens gradually, like you sometimes hear cataracts do, and you don't know it until finally maybe someone like you looks at it and you do a test and you say, wait a second, you should be seeing that.
Absolutely. A lot of my patients will come in and they'll come in for a routine exam, and it's been 4 or 5 years, and they'll tell me they're seeing perfectly out of their glasses. And luckily, most of the time, it's just a prescription change. And I'll show people in the machine what it looks like with the old versus the new prescription. And they're floored a lot of times. They don't realize how blurred their vision has gotten because it just changes so gradually. You don't really ever notice it until you come in and get the new prescription.
Okay, so if you wear glasses and you're someone that is normal in general, like I got to the point where all of a sudden I needed glasses. I realized that, and I'm just naturally aging, and my eye muscles are weakening like it does in all of us. How often should you go and update your glasses or have your eyes checked if you're not having any problems, but just to update yourself?
I still recommend getting the yearly eye exams, even if you don't need new glasses every year. A lot of my patients can go 2, 3, 4 years and sometimes not have to update their glasses, but just to get those yearly eye exams to make sure that none of those health conditions are showing up, because so many of the health conditions, whether it be diabetes, blood pressure, autoimmune issues, there's so many things that can show up in the eyes, and unless we look, we don't know what's going on. And I would recommend getting that checked every year, especially if you have any family history. Yearly eye exams are great.
That's what I was going to say.
Absolutely.
So family history, because I was wondering, what gauges, what's going to cause, what are you looking for specifically in someone, starting, like with me, it really kicked in when I turned 40. All of a sudden, it's like a switch went off, and my eyes are just, and it just progressively kept getting worse. Now, is it going to accelerate the deterioration of my eye muscles and my vision continue, or is it going to plateau at some point and not get any worse?
That's a very good question. It really depends on how your eyes change. Usually the most changes we get for our patients is between ages maybe 40 and 50, and then it usually plateaus pretty good. The other thing that can cause changes after that, though, is if you start getting like a pre-cataract to early cataract change, it actually will, the yellowing that you get in that structure in the lens in the eye can actually change the way the light bends into the eye, so it artificially changes your prescription. Most of my far-sighted patients do tend to get a little bit worse each year. A lot of my near-sighted patients actually their prescriptions actually get a little bit better each year, not to the point where they don't need glasses, but it actually improves a little bit. So it's more slow changes after that, unless that cataract really starts changing. So usually between 40 and 50 are the biggest changes, and then after that it's pretty gradual.
I know you have patients of all types, age-wise. I mean, have you ever seen someone in their 70s or 80s that did not need any glasses at all?
No.
It just goes without saying. I mean, meaning they still can see very well, but they need something, if only to read.
Right.
But, I mean, it would be extraordinarily rare to find, and I'm sure they exist out there, but for someone in their 80s to have 20/20 vision and need no glasses at all, or contacts or whatever.
The only ones that I've seen are my patients that are maybe low nearsighted, where they're about maybe 20/40 for the distance, maybe not driving anymore, or even they are driving, maybe should be wearing glasses, but they feel like they're seeing well enough. If you're low nearsighted, you still have some focusing for up close. So some of my patients that are kind of maybe mildly nearsighted can go without wearing the glasses. They should probably have them on for driving. I do have some of my patients that tell me they just would rather not wear anything at all, but they need the prescription, but they choose not to wear it.
I see, but it's a given. When you age, at some level, you're going to need something.
Exactly.
It just is a fact of life. Thus, many of you probably watching dealing with that. We're going to take a break. We've got to take a break. When we come back, the number is 737-7587. If you want to jump in, we're going to open up the phone lines. Questions, free medical advice. You'll answer the questions free of charge this morning. And as I said, a lot of you dealing with the issue of cataracts. She touched on that a moment ago. That's something we can talk about, the treatment and what's happening there. Glaucoma, macular degeneration. I'll have you define that for us when we get back again.
Absolutely.
So we'll be back with your calls and more of our conversation with the good doctor right after this. Stay with us.